Hello everybody. This is a video about integrating physiology knowledge of acid-base balance in the body with physiology knowledge about how the lungs work with mechanical ventilation of patients. So when you're an intern or a resident and you are on an ICU month, whether you're a surgical intern or a medicine intern or a psychiatry intern rotating on the ICU for a month, you're going to have to know how to fix things in the middle of the night. The main problems you're going to have to know how to fix on these patients that are intubated on a mechanical ventilator are going to be problems with oxygenation, problems with elimination of carbon dioxide, and problems with the vital signs. So problems with the vital signs typically go under the heading of shock. You have other teaching episodes about shock, and we're not going to go into that too much here. I will say if you have big problems in oxygenation or big problems in carbon dioxide elimination, you will develop secondary problems in your vital signs or shock, so that's all kind of the same syndrome. The things we'll focus on today is how do you know if your patient has a problem of oxygenation or carbon dioxide elimination, and then what are the things that you have to do in the middle of the night to fix it on a mechanically ventilated patient. How's that different than a patient who is spontaneously breathing on their own? So that's kind of what this case is all about. So if we look first at problems with oxygenation, there's going to be a couple different ways that you're going to know that they have a problem. So one, your sat monitor is going to be abnormal. Okay, and that's the fastest way to know. That's a monitor that looks like a clothespin that's on the patient's finger or earlobe or sometimes forehead at all times. And the nurse will call you and say, Mr. Smith's having trouble keeping his sats up. I've turned up his oxygen, but it doesn't seem to be working. So then your next step that you'll probably do is you'll probably get an arterial blood gas and look at not only the saturation of oxygen, percentage of cars on the highway that are carrying oxygen, in other words, on that blood gas, but you'll also look at the value we teach you about in physiology, the arterial pressure of free oxygen, so free oxygen that's dissolved into the arterial blood. Normal value for the PaO2 is going to be 70 to 90, 70 to 100. That's where you would like a normal patient to live that's really just breathing room air. A lot of ICU patients won't be there. The PaO2 will either be much, much higher than that because you're having to do other things with their lungs to keep them healthy, or it'll be much lower than that and you're trying to compensate for it. So that's another place that you can look for abnormalities in oxygenation. So once you know you have a problem with oxygenation, what are you going to do to fix it on a patient that's on the mechanical ventilator?